Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today, providing the right information and right care for the right patient at the right time. Cancer care teams can do this using the 4R Oncology Model. This model uses patient-facing one-page care sequence plans to improve patient engagement and facilitate care coordination to the right patient at the right time. On the show today is Dr. Raymond Liu, Director of Research of Hematology-Oncology at Kaiser Permanente Northern California. He's also Director of Cancer Survivorship at Kaiser Permanente San Francisco and Assistant Clinical Professor at UC San Francisco. Great to have you here today, Dr. Liu. Why did your team choose to implement the 4R Oncology Model?
Well, I saw the 4R program at an ASCO, American Society of Clinical Oncology conference, and there was a poster there staffed by Julie and Christine. They're the ones that run the 4R program nationally, and was really struck by this concept that we've been searching for a patient-centric, high-quality, value-based care approach that actually can deliver a care plan to the patient in a way that's sequenced and can help us understand interdisciplinary care. And so it really was the right thing to do at that time to approach them and ask, hey, how do I get involved in the program, and how do I improve the quality of the care I'm providing for my patients?
How do you define a high-functioning team, and how did 4R help develop that?
So the 4R created the infrastructure to allow us to think about what a team is. And what I mean by that is it's a single care plan that's given to patients that explains the timing sequence of care from different disciplines. So by actually building the checklist that is the left side of that care plan, we were able to actually bring the right people together to have those conversations, to discuss what the right timing and sequencing of that is. We came together as in a common goal to try and improve that care sequence and improve the care we provide. We were able to actually start mapping interdependent care together and finding exactly the right sequences. And then we realized we had some plan, do, study, act cycles to do. So we had to actually make some improvements. So those are the major elements of a strong team, as has been published in literature. And we were able to develop that explicit team, that sharing a common goal, achieving interdependent work, and then, of course, adapting that for sustainability. So the 4R process already allowed us to do all those things, and so naturally brought those teams together to improve quality.
Describe the process of implementing this model in your clinic.
So I think what we did with the 4R was really to work with Julie and Christine and the 4R and really map out those processes. Let's really take that approach where we understand what's happening to each of our patients with breast cancer and lung cancer in this case, and then really start working on small tests of change, nothing too big. And so we, for example, implemented we had a multidisciplinary breast cancer clinic that we implemented in, and we had a nurse navigator, and she was very, very engaged. And so that's another example, taking passionate people and engaging them early. What we found is we had to do a small test of change that would really help her with her practice to make it sustainable. And so we set out to say, hey, if we did explain this, we're using a one-page care plan. If we explained the care to the patients, would there be as many callbacks after the clinic asking about what happened at the clinic? And so we tested it out. And within a couple of weeks of implementing the plan, our nurse navigator came back to us and said, absolutely. We used to get 20, 30 calls the day after the clinic, people asking, hey, what did the doctor say at the meeting? And those calls essentially went away. When people could see that plan and they could bring that home with them, and they saw that it was all guideline-based and mapped through in a very, very detailed way, they were empowered to answer their questions, especially for their loved ones, and to really reflect on what was said at home. Again, the care is so complex now, right? Our innovations are really, really going fast, but we have not been able to deliver the care in a way that's understandable sometimes. And so by putting in a single care plan, the patients really engaged with it, and we found that the call volumes came down. That was the early buy-in that we needed. And from there, we started tackling more and more things. And we just chose simple things that sometimes the nurse navigators would bring to us, sometimes the patients would bring to us. And as each member of the care team got more and more engaged, we started doing more and more things. And in that single year, we were able to optimize 40 different things in our breast and lung cancer patients. And we've now published since then on a couple of those.
What can you tell us to help other clinics understand and implement 4R?
Well, I think a lot of people, it feels abstract, I know, because like the concept of 4R, you're saying, okay, well, R is right information, right care, right patient at the right time. And we understand the concept of care plan, but what does it look like? So there is a website now, 4roncology.com, and there are the papers that we've written now to help explain to people, what do these care plans look like? How do we deploy in the system? I think the goal is to also make this generalizable. We know that over 20 health systems now across the country, including safety net hospitals, academic centers, community programs, integrated systems like ours are deploying it and showing success. And the goal is actually to make it more generalizable, to allow folks to use it to help improve the care they're providing for patients. So there is a website now, and there are publications now. And so as people get familiar with this, I'm hoping that they'll have that experience as well.
Thank you, Dr. Liu. You can visit the show notes for resources on the 4R Oncology Model and how to apply it in your clinic. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.